Go
Okay,
for it.
hi guys, I'm Janice. Our first speaker for the day is Dr. Tim Cunningham. He's the current Vice President of Practice and Innovation at Emory Healthcare and has used his talents as an entertainer and medical professional to help others around the world. We're very excited to be here today, and I'd like to say thank you to Dr. Cunningham for joining us.
Janice, thank you so much for that introduction. And thank you all for taking some time out of your day to chat with me. It's an honor to be able to connect with so many people through technology in so many different places, and also quite a challenge. And want to sort of respect both aspects of that while we talk a little bit today about leadership, about resilience, and whatever else comes to mind. Now, you all will probably learn very quickly, I like to talk, and I can talk for hours and hours and hours. If you have a question, if you have a concern, if you have a thought, if you have hey, tell me that again because that didn't quite make sense, or hey, I want to learn more about this, feel free to hop on the chat box. Also, feel free to turn on your camera and unmute your mic if you have a comment or a question to connect that way. If you want to keep your camera on while we chat, it's totally up to you. It's really profoundly challenging what we're facing right now. And as we talk about this work today, I also want to recognize that we are all facing significant stressors, significant challenges that many of us have never faced before. And when we think about resilience, I feel and have learned and studied, I'll share some of my background so you can understand a little bit more about it, that without resilience, it's really hard to thrive. Without resilience, it's really hard to find sort of the meaning and the connections in what we do. So today I want to share some stories, and I'm going to share some screens. If you don't have a screen in front of you, send me a little message and I'll sort of describe what I'm sharing on the screen. I don't want to assume that everyone's looking at a screen right now. And I hope through some of these stories and some of these thoughts, you might have some new ideas around resilience and leadership. For one, I don't think you can be a good leader without your own personal resilience, one. Two, without the ability to support the resilience of your team that you're leading. I think the two go hand in hand, and I think if one piece is missing, you're out of luck. So just a thought. But let me take a step back and share a little bit of background. So as Janice mentioned, I was an artist, a performer, before I came into my current leadership role. I graduated undergrad, and I went to a clown training program in Northern California, and I spent a year studying acrobatics, dance, movement, the performing arts, and I fell in love with a capital L, with the ability that actors have to connect with an audience. And those of you here on the Zoom that are musicians, that are artists, that like to paint, that like to sculpt, that like to act and perform, there's this magic in that work and how we can connect with each other as human beings, with or without words, with or without images. And that was the work that I did for almost a decade, about a good 7 years. I was working as an actor. I've worked in about 21 different countries as a performing artist. And I started working with, and then I became a leader, an executive director of an organization called Clowns Without Borders. Yes, I am a clown, but I don't want anyone to freak out. I hope no one is like clicking off the Zoom. I'm not going to do anything clowny in this next hour. I promise you, but I might juggle. The only clowny thing I'm going to do is I'm going to juggle for a hot minute, and then I'm going to stop juggling because I know some people in the US are afraid of clowns. And the reason I say some people in the US, I've performed, like I said, in about 21 other countries. I've never met someone afraid of a clown outside of the US. So it makes me wonder, maybe American clowns just aren't as funny and a little more scary. That was the beginning of my career. I was a clown. And then my beginning of work in healthcare was I got hired by this group organization called the Big Apple Circus. And our job was to work as clowns in pediatric hospitals. So I worked at Boston Children's Hospital up in Boston, Massachusetts. My job as a clown was to go into patients' rooms and families' rooms when I was invited. And I didn't just bust in as a clown because that could be scary too. We go where we were invited, and we would connect with the patient, the child, and their family members. And sometimes people laughed. Sometimes people sat up in bed and hugged. I saw many people who were literally actively dying. Literally, they died a few days later, but had the ability to laugh and connect with their families because of what the clowns were doing through laughter, through joy. Really amazing stuff. And so the first white coat, because we know of like doctors and things like that, they always like go around wearing white coats and acting all formal. So this is my first white coat. And you can see on the back of the white coat, it says the Big Apple Circus. Janice asked me earlier if she should call me doctor, and I was honored that you asked. I have a doctoral degree in public health, but the first time I actually had a doctor name, I was called Dr. Bumble, and I roller skated through hospitals. And that inspired me to become a nurse. I watched the way that nurses and other physicians and social workers and occupational therapists connected with people who were suffering, who were sick, who were in pain. Some of the people they connected with were having the worst moments of their lives. And I was curious about that magic. How do people connect? So I went back to school. I studied nursing. I became an emergency room nurse. I'm a trauma nurse, which means I work in emergency rooms where we sort of see the sickest of the sick people in the worst of the worst cases, bad car wrecks, gunshot wounds, things like that. I worked in New York City, Washington, D.C., and a few other places. And in doing that work, I had the opportunity just to work internationally in other healthcare settings, in refugee camps and war zones, to work as a nurse, blah, 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 blah. All of that work inspired me to keep asking the question, keeps you resilient? When you're facing adversity, when you're facing challenges, what inspires you to get out of bed the next day to keep going into things that are stressful? And I kept asking the question, how do nurses and doctors do it all the time when they know they're going to see people who are sick and dying and suffering and angry? As an emergency nurse, I faced off with a lot of patients who've got up in my face, sometimes with knives and weapons, not because they're against me, but because they're afraid, they're sick. There are a lot of violent responses. And so I'm ever curious about what keeps people going. Fast forward to now. My title is Vice President of Practice and Innovation at Emory Healthcare. So I'm kind of responsible for about 7,000 nurses across our whole health system. I'm also responsible for about 23,000 staff members to help support programs to keep people resilient during these really challenging times of COVID. I love what I do. All my hair is falling out because I'm so stressed out, but that's okay. I just grow it on my chin. And it's beautiful to be able to connect with people. And then going back to this idea of leadership and resilience drives leadership, and leadership drives resilience. So I'm going to pause for a second because, like I said, I can just go and go and go. But I want to ask you all a question. When I say resilience, what comes to mind? How would you define it? And feel free to chat in the chat box, or if you want to unmute and share. What does resilience mean to you, and how would you define it?
To me, resilience is like the ability to withstand like tough times and be able to thrive and keep moving forward.
Thank you. Thanks for sharing that. And I'll read what I see in the chat in case not everyone has a screen, but feel free to unmute as well. I see staying true to yourself regardless of what the circumstance may be. I see being able to hold yourself up even when things are tough. To me, resilience is getting up after you fall and to move on after tough times, being adaptable to life. Think about that. Clowns do that all the time. What makes clowns funny? It's when they trip and fall and get back up like a bouncy ball. Resilience, what else does that mean? Wanting to try again and again, yeah. And then what fuels that want? What fuels that desire?
To me, motivation or resilience is like the motivation to keep going after you fail at something.
Awesome, thank you. How hard you can get hit and keep moving forward. Being stubborn in a passionate manner. I like that. There's this idea like fierce compassion, being stubborn, but in a passionate manner. persevering through hardships. Coolness. I want to share a couple stories about resilience that I've learned as a leader. And even if I'm not talking like a leader talks, I'm sorry I didn't wear a necktie. My neck was sore today from wearing ties, so I'm going tieless. But I want you all to think about, as we talk about this, how do these stories pertain to aspects of leadership when it comes to resilience? And I want to say, for one, that we haven't defined leadership. Much of leadership is, what does it mean to you? What does it mean to your team? And how do you live with that and respond to that? Same with resilience. We mentioned earlier, I have a doctoral degree in public health. So I have a PhD basically in public health. And so I wrote my dissertation on resilience, big, long paper, spent a lot of years in school, reading, studying. And you know what I learned is that there's still not. There's not one key definition of resilience either. So what you all just share, persevering through hardships, being stubborn in a passionate manner, how hard can you get hit and keep moving, wanting to try again and again, being adaptable to life. What you all shared with me is spot on for resilience. And we know the definition of resilience is as unique as you all are. So I'm going to share some stories about resilience. And before I share them, think about this for a minute. I know that many of you on this call practice resilience every single day. And maybe some of you don't practice resilience every single day, but I know that all of you on this Zoom at some point in your life have had to practice resilience. And what do I mean by that? I mean by, think of the place where we live. Think of the country that we live in right now and everything that's going on, everything you've experienced in your lifetime. Many people have been, and continue to be judged by what they look like, by what the color of their skin is, by what religious or spiritual practice they have, by who they choose to love, by what country they were born in, or even what state they were born in. So when we talk about resilience, I know that you all have practiced it to different degrees just by being who you are. And take a minute to recognize yourselves. None of which I'm talking about today is going to be brand new to you because it's inherent in all of us. And it's important to recognize and honor and know that we build resilience on top of itself rather than starting from scratch. So just think about that as we move forward. I'm going to go ahead and share my screen here for a second. And this is a conversation that I call Finding Florence. Oops, let me get that screen share back 1 second. I clicked too fast. There we go. I call this Finding Florence, and it's a series of stories around resilience. And I think we'll get to leadership too. This is Florence. This is a photograph of Florence. Florence Williamson, an amazing, amazing, amazing woman. Yes, that's a turkey on her head. Florence was one of my first mentors. And you cannot have strong leaders without good mentors. And you cannot have resilience without mentors and mentorship. Like I said, I was a clown for a long time, then I went back to school. When I graduated nursing school, I became a pediatric emergency room nurse. And every day, my first few shifts working as a nurse, I was scared to death. I was afraid I was going to hurt someone. I was afraid I wasn't going to do something right. I didn't know, what if a child came through our doors and we were doing CPR on that child who had been hit by a car and the child died in my arms, and that happened frequently. I was so afraid of what I would see. And Florence, this is Florence. Florence had been working in that hospital for years and years and years and years. And Florence was the most trusted person there. Florence only worked night shift. And anytime we'd have a holiday, she'd wear her hat like this turkey hat, where she would work a night shift from like 7 p.m. until 7 a.m. She would go home on holidays and cook a huge meal. And then that night, bring that meal to the whole emergency department staff and would feed us. She loved feeding us. She had a few adopted kids. And she, when we think about leaders, was kind of a secret leader. Now, often when we think about leaders, we think about people wearing neckties and nice business suits and fancy clothes, driving fancy cars with a lot of bling on their bodies, making a lot of money, being the heads of this and director of this and doctor this and that. And that's a form of leadership for sure. Florence was a different kind of leader. Florence was a certified nurse's assistant, a CNA, which means if you think about a hierarchy, she was kind of the bottom of the hierarchy when it came to education, when it came to, publishing papers and doing research and all that stuff. But what Florence had more than almost every other leader in the hospital was a deep sense of wisdom. And so Florence would see me come into work for those night shifts afraid, and she would take me under her wing, and she taught me how to be a nurse. She taught me how to communicate with families who were afraid, who were struggling. She taught me how to take a breath and a pause when I was really stressed out and worked up. And Florence was so good at that, other doctors would come and ask advice from her. Other students would come and ask advice from her. Even like CEOs, the chief executive officers, and CMOs, the chief medical officer of the hospital, would go to Florence. They'd show up at night shift and ask her questions. So when we think about leadership, it's important to think about wisdom and where we find wisdom. And as leaders, how do we recognize the wisdom around us? There's a quote from a book that I'll share a little bit later that says, wisdom is like water. It can be found in the lowest of places. Think about that for a minute. So water, when it rains, water collects in the lowest places. That's physics. Wisdom is like water. It can be found in the lowest places. And I think sometimes we forget, especially as we sort of climb the ladders as leaders, to recognize wisdom all around us. And as we grow as leaders, how do we keep asking the questions to people around us to seek that wisdom, to do what's right, to do what's kind? And that in itself is a kind of resilience. Next story. So I thought about Florence frequently, and this is late 2014, 2015. I had a job in which I was doing a lot of emergency care to children and pediatric patients. Anybody remember what was going on this planet in late 2014 and early 2015? Let's think global health. Let's think big picture. Anybody remember? And I'll open up the chat box and see. Ebola, yes. Thank you so much. Ebola. Actually the very end of 2013, December 26, 2013 is when we recognized the first patient with Ebola. That was a 2-year-old from a rural region of the country of Guinea in West Africa. From that date until March, I believe March 16th, 2016, we saw the world's largest Ebola outbreak in West Africa. And West Africa, primarily 3 countries within West Africa: Sierra Leone, Liberia, and Guinea. This is where I learned the most I've ever learned about resilience and leadership. So I was living in New York City at the time. I was studying leadership. I was studying resilience. I was writing papers to get my doctoral degree. I was working night shifts as an emergency nurse to pay for school, and Ebola hit. And there was a call for nurses and physicians from all over the world to go into the worst hit regions affected by Ebola to serve patients. And so this is a picture of me in the middle. My friend Bex Rollins took this picture. And this was our PPE. I think you've all probably heard a lot about PPE by now with what's going on with COVID. This is the PPE that we had to wear to protect us from one of the world's most dangerous diseases. And every day in these suits, it got like 130 degrees Fahrenheit inside these suits. So we're wearing these suits, dropping beads of sweat. We had a survival rate for children. Remember, I'm a pediatric nurse. The survival rate for children was only 20% for kids under the age of 5. So COVID's bad, yes, because it's spread all over the world. Yes, it's completely out of control. Yes. Ebola was bad at the time in that it was far more deadly and far more hard to manage because we were in very resource poor areas. And so as a pediatric nurse, 8 out of every 10 children I treated died, and often in my arms or the arms of our teammates. Fortunately, the picture of this child, this is a child who came to us in the middle of the night who was sick with Ebola. The child's parents were with them. They also had Ebola. Fortunately, this child and their family survived. But when we think about resilience, when we think about leadership, when we think about wisdom, the hospitals and the health systems around the world that are doing their best with the COVID response are folks that have learned from other outbreaks like Ebola. Folks that have gone back into the worst hit countries of West Africa to ask people who had survived Ebola, how did you do it? What kept you grounded? What kept you connected? And how can we learn from that and grow from that? And in doing that and learning from others, we build a sense of resilience by listening, by practicing, by connecting. As we think about where we are now with COVID and think about, so Ebola lasted late 2013 into middle 2016, early 2016. Communities in Sierra Leone, Guinea, Liberia were all under lockdown for almost 2 or 3 years. And y'all remember when we started locking down in this country because of COVID, people were freaking out. People were saying, this is not real. We don't need to lock down. And some of the states that had the best responses had strong leaders who said, we need to practice social distancing. We need to make sure everyone wears a mask. And we know scientifically, that's the right thing to do and the safe thing to do. And so those states that locked down early had lower case numbers. But think, we were doing this for even a few months and people were freaking out. People are still freaking out. But our neighbors in West Africa did that for 2 or 3 years because Ebola had very similar lockdown rules because of its spread. When you think about resilience, especially for you all, as you move into leadership positions throughout your career, build resilience by asking questions, by connecting with people all around you, because it makes the people you connect with feel empowered, which builds their own resilience. It also helps empower you because you can make the right decisions. And that's something that I struggle with all the time with my work because I'm worried about our teams. We've got 7,000 plus nurses who are exhausted. We see a lot of people with COVID every single day, and we see a lot of people out in the public around this state not wearing masks, and we know that those people are going to get sick. And I have to make decisions to help support my team and support the patients and families we treat and how we communicate that. So how do we do it? We're going to take a step back for a second. Story number 3. If you don't have a screen in front of you, I've got a picture up of an orchestra right now. And those that you can see the screen, if you've ever been to an orchestra, maybe bring that to mind. If you want to do a little exercise, you can even close your eyes and sort of visualize this with me. But imagine for a minute an orchestra in front of you. You're sitting in the audience. And imagine that all of a sudden the stage, this full orchestra, all of the people leave the stage. This is a resilience technique 101. Here we go. So all of a sudden you're looking at a stage that's only instruments and no humans on the stage. You've got violas, cellos, basses, violins, you've got a piano, you've got a harp, you've got some percussion instruments, stage full of instruments. Got that in your mind's eye? Now imagine with me, one individual person walks out to the middle of that stage. And they have, let's say they have a violin in their hands. And so they stand up in the middle of the stage, maybe where the conductor is standing now. That one person on the stage full of instruments stands there and plays the A string on the violin. So imagine that for a minute. And then I'm going to ask you all, what happens? You're looking at a stage full of instruments. There's only one human on the stage. That one human is playing that one A string on that one violin. Can anyone tell me what happens? This is physics, and it's also resilience. Any ideas? It's pretty cool. Great, thank you for asking that. The question, do all the strings of the other instruments resonate as well? 100%. That's exactly right. Imagine that. And you can measure this. You can put devices on every single string on every single instrument, and you will find every other A string on that whole stage begins to vibrate. It's called sympathetic resonance. And what sympathetic resonance by definition in physics says that when you have two vibratory objects in space with the potential of being able to vibrate, and when one begins to vibrate, if the other object or objects has the potential of vibrating, it too will begin to vibrate. Sound waves, energy waves causes them to vibrate. Again, that's called sympathetic resonance. Now think for a minute, especially those of you, I think many of you are juniors, those of you, and some of you are seniors, as you think about your next steps in your lives, and think about maybe a kind note that a friend wrote to you, a kind message someone sent to you to, you know, kind of be nostalgic for maybe years past. And when you read those words, remember for a moment how you felt. Or perhaps when you listen to your favorite song or a beautiful piece of music, sometimes that sound comes into your ears, and then you feel it in your body. You might feel tingly. You might get butterflies in your stomach. Your heart rate might speed up a little bit. That person you might have a crush on, they make eye contact with you for a minute. Notice how you feel. Think about pieces of art. Maybe you've seen a beautiful painting, a beautiful sculpture. Think about a favorite movie scene that you've seen. And when something occurs, you don't not only see it, but you feel it in your body. So we've got sympathetic resonance. Let's take it up a level and consider this idea of empathetic resonance. As human beings, we're all vibratory objects, so we can vibrate with the energies around us. And part of my work as a leader is when I go into a meeting, when I go into a hospital at 3 a.m. to meet with nurses to talk about how they're doing and to listen to how they're doing, I know what's going on in the room sometimes by how I walk in, because you just feel the vibes, right? We vibe with each other. Empathetic resonance is all about recognizing what those vibes are and feeling it, experiencing them. How does this build resilience? We're going to take it up a level now. Y'all still with me? We've got sympathetic resonance, that's physics. We've got empathetic resonance, that's human and how we connect. And when we plug in the resilience and the leadership, we take it up a level to compassionate resonance. And compassionate resonance occurs when you walk into a space, when you connect, you see suffering in front of you, you see challenges in front of you, and then you use your leadership skills, you use your wisdom through experience, through knowledge, to do something to change the situation. And in changing the situation, you do what the Dalai Lama says, you bring compassion, you help to end suffering, and you bring healing. So we know that when you do things that are compassionate, meaning you witness suffering and you do something to change it, we know that that actually strengthens your mind. There's good neuroscience behind that of how it refuels your mind. How do you think our nurses are still trucking through COVID month after month, day after day after day, treating people, seeing people die? I have some very good friends at the Johns Creek Hospital. And in fact, one of my friend's fathers died at the Johns Creek Hospital and received amazing compassionate care. What keeps people going? It's the ability to practice and provide compassion. And so as leaders, we get fueled off of being compassionate. And you can measure that. The brain actually gets fueled. But it begins by seeing. I want to share another image here for a second and ask you all, when you see this, anybody know what this is? Any guesses while I chew on my finger because I have dry skin? What do you see in front of you? And feel free to unmute or chat in the chat box. What does that look like?
It kind of looks like the slums in Mumbai.
It kind of looks like the slums in Mumbai. Thank you for mentioning that. And it's I appreciate you seeing that. This is a photograph that I took in 2017, in January of 2017. The year had just turned, or maybe it's 2018. Oh, it's a blur now. This is in the world's largest refugee camp in a town called Cox's Bazar in southern Bangladesh. Anybody know anything about refugee camps in southern Bangladesh? What comes to mind? So in Myanmar, once called Burma, there has been an ongoing genocide of Rohingya people. Rohingyas are generally people that are Muslims living in a predominantly Buddhist country. And for years since the end of World War II, they have been systematically discriminated against. And then in 2015, 2016, genocide began in which Rohingyas were singled out and murdered brutally over a long period of time. Many Rohingyas fled to this area that you see in front of you. This used to be a vast forest, a vast jungle. Wild elephants roamed. In fact, the clinic where I worked, we treated some people that had elephant injuries where an elephant trampled them because they had built homes there where the elephants were. And so now this is a refugee camp with nearly 1 million Rohingya refugees, the largest refugee camp in the world of people who have fled genocide. I spent some time working with a group of nurses and physicians in a clinic to offer medical care in this camp. This is what we saw every day. These are people's homes. This is all they have left. And people would come into our clinic. We saw a lot of maladies, a lot of concerns. This was before COVID. COVID has really affected this refugee camp profoundly. And we heard a lot of stories of suffering. And we worked all day long as doctors and nurses to try to reduce suffering. We were tired, but we also felt energized by the work we were doing. And when we would leave the camp, we would sometimes be invited by families to visit their tents where they were living. And so this is a picture I took while we were walking through the camp visiting a family. And I looked up and I saw this thing right here. Anybody know what this thing is? It's a kite. And so what kids would do is that kids would collect scraps of plastic, pieces of paper, a little bit of string, a piece of wood if you could, and would fly a kite. And literally everywhere around this camp, you would look up in the sky and see kites everywhere, everywhere, everywhere. And though we witnessed profound suffering, we would walk out of the clinic and hear children laughing as they flew kites. Here's a zoom in on the kite. Resilience is another way to look at something differently. When you look at this image, you can look down and you can see these tents. These are bamboo structures with tarps on top. Imagine what happens during monsoon season when rains rain day in, day out for weeks on end. Imagine what happens when just a wind blows through. These homes are destroyed. You could look down as a leader and see that profound suffering. And you should. You could empathize with it. You can also look up and see the creativity and the ingenuity of these kids who literally have nothing more than some string and a piece of plastic to fly a kite and make this amazing feat of engineering so they can play and find joy and have fun. So as a leader, when you think about your resilience, it's about keeping your eyes open to all that is in front of you, the negative and the positive, and allowing a sense of balance to rise with that. This is an image that I want to share with you. It's from a children's book that I wrote. And it's called A Good Kite. If anyone reads Arabic, you'll recognize that this book is both in Arabic and English. And I wrote this book after I worked with Ebola patients in Sierra Leone. And this book is dedicated to, and it's about one of the first children that I treated with Ebola. His name was Desmond. And Desmond was very sick when I met him, and he died shortly after I met him. And I wrote this book to honor his life. And when we would walk to our Ebola treatment center, just like we saw in the Rohingya refugee camp, even though in the treatment center we saw some very, very sick and dying people, every day we witnessed profound suffering and multiple deaths. But at the same time, when we would walk home from work, we would see kids outside playing and flying kites. And we would stop and we would look up. Remember we talked about empathetic resonance? Remember we talked about that idea of when you witness something and you feel it in your bones, you get the butterflies, you feel the chills in your body. We would feel that empathetic resonance with kids flying kites. And though we had just witnessed we would smile for a minute. And so what Desmond and his friends taught small things to find joy. And it's those small things that build resilience over time. And as a leader, how do you help bring that out of your teams? How do you let go sometimes of what is supposed to be and allow what is to occur? And it's not easy. And what I love about my work as a leader is that this is the hardest work I've ever faced in my career. And though I have sat with people dying of Ebola, though I have been assaulted and robbed in other countries while doing humanitarian work, I've nearly been killed 3 times now, and I'm grateful that I'm still here on this planet. I've experienced a lot of challenges, But the work in COVID and supporting our team of thousands of people at Emory Healthcare is probably the hardest thing I've ever done. And I, meaning our team, the people that we work with, and I often feel like the Incredible Hulk when I learn about the injustices that continue to arise in our country, when we think about racial injustice, when we think about all the political craziness that's going on, and how I also see how that's affecting our nurses and our physicians and our patients and our families. That's a lot of stress. And then you got COVID on top of that. And I'm learning resilience is not always this kind bounce back, fly kites. That's one way. But resilience, as someone mentioned, I'm going to scroll back. Being stubborn in a passionate manner. Compassionate resonance. Sometimes you have to be fierce to help reduce the suffering of other people. And I would propose to you all that as a leader, your job is reducing the suffering of other people. And if you can do that as a leader, in whatever career path you take, whatever field you follow, you, I think, will find happiness and a sense of success. Success, it's not about making money. It's not about having a lot of letters behind your name. It's not about the material things. Even for leaders, I would suggest to you that success is helping reduce the suffering of other people, whatever that is. Sometimes you got to be nice. Sometimes you got to be a little mean. I'm going to share story number 4. I think this is story number 4. I kind of lose track. I like to show pictures and ask, what is that thing? And people lean in. Anybody know what this thing is right here? Any guess?
Rubber chicken.
Rubber chicken, you nailed it. No, it usually takes people a lot longer. I'm impressed. Whoever said that, thank you. That is a certified rubber chicken that I purchased on Amazon. Here's the story. When we were working in Sierra Leone with people who were suffering from Ebola, we found that even as people were on their deathbed, if they had a little bit of energy, they would sit up, connect with each other, smile with each other, have a conversation, sometimes laugh, and children would still play. Like the kites we saw, or even in hospital wards, children that could play would play. So I carried a little rubber chicken around with me. Well, one of my nurse friends thought it was weird at first, but as we became friends, she said, oh, okay, I understand the rubber chicken now. I was like, I don't even understand it. I just think they're funny. After the work with patients with Ebola, a good friend of mine flew to Afghanistan and started working at a trauma hospital in Kabul, Afghanistan. And many of you know that one of the world's longest known wars has been ongoing in Afghanistan, started in 2001, and is still ongoing, and there's still significant trauma and violence in Afghanistan. And my friend's a nurse, a trauma nurse, and she worked in an emergency department where they were frequently treating people who were victims of bombings, and every day in, day out, lots of violence. So one day, a child was rushed in to the hospital. And this child, you see this child's foot here in this picture. This child was out in a field playing with 2 other friends, and they were running in the field, and they saw a shiny object on the ground. And as children, you see a shiny object that's interesting. What do you generally do? You walk over, you check it out because you're curious. Oh, another beautiful form of resiliency is curiosity. How do you stay curious during stressful times? So these kids were curious because they're kids, they were playing, and they went over to the object and they reached down and one picked it up. Problem is that during war, even though these are considered war crimes, many governments around the world use landmines as a weapon of war, even though it's considered a war crime. And the children found the landmine that was set by some forces, we don't know from which country, Afghanistan, the US, it could have been any country, found a landmine, picked it up. Immediately, 2 of those children died. And the 3rd child was picked up by some bystanders and rushed to this hospital. This child in the picture lost one arm, lost the use of the other arm, and lost the use of one of his feet, which you can see up top there. Was rushed into the hospital. They had neurosurgeons. As some of you think about your career paths, go into surgery, go into medicine, go into nursing. You will save so many lives. It's an amazing experience. Was saved by neurosurgeon from the US, from Italy, from all over the world who came together, and they saved this kid's life. So the kid was in the hospital recovering, and as the kid recovered, the kid started to speak again, started to smile again, was able to eat again, was recovering mentally. And so the surgery team was like, this kid's brain is intact. This kid is functioning like a kid, but he's not moving his foot. And this one foot and this one leg, like we know it works, all the muscles work, everything's intact. We just can't understand why he's not responding. So then my friend, remember the Ebola nurse who thought the rubber chickens were weird? She carried a rubber chicken with her as sort of a way to stay connected with me as a friend and just to remember that laughter is important even in the hardest of settings. One day the team was walking by all the patients, rounding, visiting, trying to take care of them. And she leaned over and nudged one of the neurosurgeons and said, let's try this. And he said, what? And she pulled the rubber chicken out of her pocket and held it there. And he gave her this look of like, yo, we've got a lot of people to treat. Why are you flipping a rubber chicken in my face? She said, no, trust me, let's try it. And so they held the chicken out in front of the child, and the child, who since had been blown up by the landmine, had not moved his leg, looked at the rubber chicken and lifted his leg off the bed and pointed his toes up and spread them out just like this, almost waved with his, as if his foot was a hand, because that's all he had to move. And he had this big smile on his face. So the neurosurgeon was shocked. Remember we talked about wisdom is found like water in the lowest places. The people with all the quote unquote knowledge and wisdom didn't know what to do. But my friend who was the nurse, kind of lower on the ranking, said, get out of the way. This is what the kid wants. Put the head of the rubber chicken between the kid's toes, and the kid squeezed. The kid is moving his foot more than he's ever moved it since they saw him. And so my friend kept playing with him, and she pulled it back, and the kid opened his toes, and they shot the rubber chicken across the hospital ward. And you know what happened? That kid started laughing. It's the first time they saw that kid laugh. The other doctors and nurses in the ward started laughing. And in that moment, the team felt a sense of connection more than they had ever felt before. Through laughter and through doing what? Compassionate resonance and relieving suffering. And my friend will still say in that moment, the team itself felt more resilient and more prepared to face the next adversity. Someone mentioned, how do you bounce back? When the punches are hard? They knew the punches were coming. But in that moment, that gave them strength and energy to bounce back, to be connected. Fortunately, this child got better, and this child was able to go home with his parents and is living safely at home right now. Wisdom, like water, can be found in the lowest of places. And the more we allow ourselves to keep our eyes open to the resilience around us as leaders, the more we're going to learn wisdom from all the people around us. And it is my hope and my goal that the more we do that, the more we'll be able to increase compassion on this planet, decrease suffering with all the work that we do. Y'all, I warned you that I can just talk and talk and talk and talk. I'm going to take a pause and ask if there are any questions or any thoughts. Does this stuff kind of make sense, or is it a little too out there? What do y'all think?
I just want to say that, like, I don't know, I can only speak for myself, but everything you said, I don't know. Thank you for that. I was kind of curious on what it was like to work in the refugee camps and in the war zones. You gave a couple of stories, but yeah.
Sure, I'd be happy to answer that question. So the places that I've worked in my career, the Ebola outbreak in Sierra Leone. I worked in Haiti right after the 2010 earthquake in a field hospital there. I've worked in the Philippines after Typhoon Yolanda. It was called Typhoon Yolanda in the Philippines, but the rest of the world called it Typhoon Haiyan, which at the time was the largest recorded typhoon. 6,000 people died literally within a matter of hours. So every place that I've worked as a nurse or as a leader or both is different. And I think the biggest lesson that I've learned, even when you walk into an emergency situation, emergency setting, it's important if you're new there to ask questions, to take a moment to reflect on what's going on in front of you. And especially if you grew up in Johns Creek and you get on a plane to go fly to Cox's Bazar, southern Bangladesh, unless you were raised in southern Bangladesh, or unless you're Rohingya and are familiar with the culture, even though you have the desire to help, it's so important to take time to pause, to listen, to learn from people, quote, on the ground from that area who've been doing the work, to learn the way they're doing the work and adapt to that to reduce suffering. Something that I've seen a lot of challenges with is that when people like us come from resource wealthy countries, meaning financially wealthy countries, sometimes we'll fly into a resource poor country and say, well, I learned this in school and this is the way we do it where I'm from. But that might not always be the right way to do it. So one of the challenges in doing humanitarian work, and I highly recommend it to all of you, is to really sit back and listen. Know what you know, because you all are learning and have learned and will learn profound things. But before you tell someone else what to do, first listen and understand the context around you. And I think that goes not just for humanitarian work, but also for leadership. And recognize the way people bounce back on their own and celebrate it. Celebrate those wins. Thanks for asking that, Janice.
Yeah, thank you. I'm like thinking about everything you said.
As you're thinking, Janice, any other questions or thoughts? I'm looking at a couple other images I might share just to think about some things, but anybody else?
I just want to say thank you for sharing those amazing stories. They're very inspiring. And I was just thinking about how when I think about resilience, I think about people a lot of times and less about like, because I don't think I really could come up with a definition, but I was thinking about my grandmother who had cancer, and just not even just her, like my mother and my aunt, just the way that they found joy and happiness every single day, even when times were so hard for them and they had so many things to do, so many things on their plate, and they just found a way to bring joy to the hospice where she stayed and just bring joy to others. I think she prioritized, which I looked up to so much. And so when I thought about resilience, I definitely looked to that as just kind of the definition for me. So just, it really resonated with me, you talking about different people, because I think that's something, the best way to see it. So that's just what I wanted to say.
Thanks for sharing that. And maybe resilience, your definition of resilience is not a Webster's definition. Resilience, parentheses, noun, the act or the state of whatever. Maybe it's your grandmother's name. Maybe as you think about resilience, it's the name or names of people. And that's enough as a definition because you understand that, which is the most important thing. I'd like to ask a question to you all, and please give me an honest answer. I am not taking notes. I am not grading anyone on this. Does this stuff seem a little too flighty, a little too out there? I mean, we're facing the world's largest pandemic. We are currently in a political situation where we don't know upside from downside. There's so much going on and so much suffering. Is this just stuff a little too out there and not even realistic to what we're facing right now? Any thoughts that way or any concerns that way? And I'm not going to debate it. I'm just curious to hear from you all.
I don't think it is, because I think it really helped that you provided your own thoughts and your own examples. The pictures really helped to make it kind of come to life. And I think like sometimes it helps to not talk about what's going on necessarily in the political climate or the pandemic and really think about what a term like resilience means, because soon these things will pass. It seems like they won't right now, but resilience is something which we need to have just forever. So I think that it really helped. Thank you.
Yeah, thank you. Thank you for your comment.
I don't think it was out there, and I don't know if it's because like I'm just an optimist or because I'm naive, but I feel like especially now, a lot of us were growing up in an age where we're exposed to so much information, so much news. I mean, I can't really be ignorant towards everything that's going on because like the second I open my phone, it's all there for me. And it can be overwhelming, and knowing that, you know, people like us, like young people, have the potential and we have the resources. Like we don't really deserve those resources and all this opportunity compared to other people, but the fact that we were lucky enough to have that, I think we should really take advantage of it, and like you said, use it to reduce people's suffering. And I think that's, I don't know, just very hopeful. Yeah.
There's a term I recently learned called bounded optimism. And it's this idea about maintaining a sense of optimism, but also realistic. Things today, because of all these other factors, might not be perfect, but they sure are better than what they could be. Or what I want to do today. When the vaccine came out, part of my work has been helping support this vaccine clinic. We've vaccinated more than 20,000 people. It's been amazing with the COVID vaccine. And at the same time, we know the vaccine is not going to end this crisis, but it's certainly a turning point. So yeah, how do you maintain a sense of bounded optimism where it's at its core optimistic? Realistic too. The other thought, more images I'd love to share with you all as we sort of think about this conversation. We think about optimism, we think about compassion and decreasing suffering, and ultimately we think about resilience. How do we face adversity? And leadership, how do we support others to face adversity? And there's a concept that I think is really pertinent to these times, and it's this idea called post-traumatic growth. And here's this image of this tree, right? And you know, you could look at it two ways. You could see a tree that has almost all the leaves missing, gone. Maybe this tree is dying. Or maybe you see the leaves that remain, and maybe you see the light green sprouts here, that maybe there is growth happening. And we have that choice as humans. We have that choice to interpret things how we see them. We are taught to think away. We are taught to feel away. But as long as we have our own brains, we have the ability to interpret things how we see them. And this concept of post-traumatic growth comes from psychology. And it's this idea that when you as an individual, or as a community, or as a family, or as a team, this is where leadership comes in, are facing adversity, facing challenges, facing traumas. And I would say that COVID is a trauma in many ways. You have the opportunity to say, we are suffering so bad, all is lost, things are miserable, I can't move forward. That's an option. And you also have the option to wear a lens looking at post-traumatic growth. And what post-traumatic growth talks about, it asks the question, based on the trauma that you've experienced, or the series of traumas, or the ongoing trauma, if you're thinking about COVID, we recognize your hurt, your suffering, but we also want to ask, have there been moments of personal strength that you've recognized? Are there things that you realize you're stronger at doing than you would have never known had you not gone through that trauma? Are there closer relationships because of the traumatic experiences or experience that you see differently, you cherish differently? Have you developed a greater appreciation for life? Question to ask. And you don't have to say yes to all these questions, but it's just something to think about. What are new possibilities? I can say from my leadership role in healthcare, we have meetings all the time trying to figure out how are we going to support all of these sick people in our community, because we have so many people sick with COVID right now. And we haven't given up, thank goodness. But every day, sometimes we have brand new ideas that we're able to roll out and apply and save lives. So new possibilities is a huge thing we're learning in healthcare because of COVID. And we've learned so much. And my hope is when COVID's gone, we can continue working with these new possibilities. So when we go back to normal, we actually will have stronger health systems. And that's my role as a leader, to sort of keep those in check, so I know when we can roll those out, even when COVID's done. And if you're religious or you're spiritual, What's the spiritual development that you've experienced and you've witnessed? And how do you honor that? How do you celebrate that? And how do you find joy in that? And when it comes down to it, for those of you that have been snoozing during this conversation, wake up just for a minute. And those of you that maybe lost track and got distracted because we're looking at screens, there's one last take home I'd like you to think about. And it's a sense of camaraderie. There's a wonderful novel called The Plague by Albert Camus. Maybe some of you have talked about Camus in some of your classes, or maybe you'll study Camus in the future. But Camus, and I love to read, wrote this book called The Plague. It's called La Peste if you read French. I'm sure it's even better in French because it was originally written in French. But he writes about a fictional plague that spreads throughout a city in West or Northeastern Africa. It's fictional. But he has a line in The Plague where he says, "A loveless world is a dead world." And it's haunting. He says, "A loveless world is a dead world." And what he means by that is that if we lose a sense of camaraderie, if we lose a sense of connection, we begin to lose resilience. As leaders, we rapidly lose our skills as leaders. And as that sense of connection dissipates, we lose our sense of connection with the world. So one thing, if you only remember one thing from this conversation, is seek camaraderie with your friends, with your family, with your community, even if you got to do it through Zoom, even if you have to find creative ways, new possibilities, right? Post-traumatic growth, seek that camaraderie, build that camaraderie, support that camaraderie. And that will help you maintain resilience. Takes practice, takes effort, so that when the adversities continue to come, because they will, you can roll with those punches, you can bounce back, and you can reduce the suffering of yourself and other people.
Thank you
Thank you
for
so
speaking
much.
today. I think it's time for us to wrap up. That was that was awesome. Thank you.
Thank you all for having me.